Welcome to my OMED 1362 presentation on the psychological factors in older patients at risk of falling. This presentation will include information on falls, treatments, psychological and social factors with the use of a case study and relevant guidelines. Falls are one of the most common and critical problems faced by healthcare providers internationally. Some common causes for falls include visual impairment, peripheral sensory neuropathy, stroke, and transient ischemic attacks. People aged 65 and over is suspected to rise to over 40% in the next 17 years to 16 million within the UK. 30% of people currently aged 65 and over have suffered a fall. This figure is higher in patients aged 80 and over, as 50% have fallen. The cost to the NHS is estimated to be around £2.3 billion each year. My case study is a 77-year-old female who has fallen. The patient has slipped from her chair onto the floor and is unable to get back up. Patient lives alone and has 3 carers a day. The patient also has the use of a link line. On examination, the patient had suffered no injuries, no loss of consciousness, left-sided weakness from a previous fall, which was normal for her. Lewisham is an urban area with 275,900 inhabitants. Of this, 53% are white and 47% are black or ethnic minority. Lewisham is in the top 20% most deprived areas within the UK. 26% of Lewisham residents are living in poverty, and the average life expectancy is 81.3 years. There are 42 GP practices and 1 accident and emergency department. For Lewisham and Falls, 26,200 Lewisham residents are aged 65 and over. The rate of falls for patients 65 and over is 8,908, and 3,930 people aged 80 and over fall twice a year. Some psychological factors surrounding falls. Falls can cause a loss of confidence, leading to the patient suffering distress. This can lead to patients suffering with long-term depression, and 1/3 of fallers develop a fear of falling again. There is also a risk that patients may develop post-traumatic stress disorder as a result of a fall. There are also some social factors. Falls can cause a restriction in activity, leading to the patients feeling socially isolated and being restricted to their homes. There is also a sense of loss of independence felt by patients. There is a link between the risk of falls and health education. Patients who have fallen are likely to fall again. A study by NICE showed that education significantly reduces the rate of falls. So the more educated patients are, the less likely they are to fall again. This is reducing hospital admissions. What interventions? A clinical intervention set up by Lewisham is the Lewisham Community Falls Service by Lewisham and Greenwich NHS Trust. They offer physiotherapy, which offers home-based exercise and gym classes for patients aged 65 and over. They also offer occupational therapy, which include a home hazard checklist, handrails and walking aids. A study by Davison et al. Showed that there were 36% fewer falls as a result of physiotherapy intervention. Some other clinical pathways include GP, Lifeline and community nursing team. So some non-clinical interventions. Lewisham and Southwark Healthy Living Centre, set up by Age UK, aims to improve physical and mental health of patients aged 55 and over with the use of social clubs and meets. Other non-clinical pathways include home help, social clubs and the Royal Voluntary Service. There is also some information below on associated treatments. NICE have set up a pathway for clinicians in relating to falls. London Ambulance Service also have a falls decision tree for their employees to aid them in the treatment of a faller. In conclusion, prevention and intervention, especially education, the use of other care pathways will help in reducing patients suffering falls. Thank you very much.